I'm washing my hands. My name is Faye, and I'm going to be doing your physical assessment today. Is it okay if I record it and my instructor view it?
Yes, ma'am.
Okay, thank you. My name is Rebecca Faye Edwards, and I chose Systems 1. And what is your name and date of birth?
Megan Clark, 12/11/87.
Okay, thank you for that. And so we've already conducted her medical interview, medical history, and there's no outstanding medical history. She has, her vital signs are good. Her vision is 20/20 on the Snelling chart. Her blood pressure was 120/72. Her pulse was 82. Respirations were 16, and her temperature was 98.2. And she has already voided her bladder. We're comfortable and doing well. So now we're going to go ahead and get started with our exam, okay?
Okay.
First of all, I'm going to be touching your head. We're going to be checking for nodules or bumps, any irregularities in the scalp or skull. We're also going to be looking at the hair. The hair is shiny, it's washed, and good hygiene. Scalp is good. Okay, you looked at that. Now we'll go ahead and move on to our, we're going to check our temporal pulses. And now here's the tibiomandibular joint. If I can have you open your mouth and close one more time for me. Oh, it popped that time. See, we have a little bit of discomfort with that, don't we?
Mm-hmm.
Okay, next we're going to go ahead and look for symmetry in the face. We see it. Your brows and lashes and lids are all symmetrical. Your ears are symmetrical. And we're going to go ahead and feel for your carotid. We got a nice pulse here, bounding +2. Same on this side. That looks great. Now we're going to go ahead and finish our eye exam. I'm going to, first of all, get my pen laid out, and we're going to take a look here. If you'll just look straight at me, and we're going to shine, and this is looking at the symmetrical, and her pupils move. We're going to go ahead and check the pupil for constriction, and that constricted nicely with the light, as this one did. And now if you'll look at my light, move it in, that your eyes accommodate well. They're equal reactive, and your pupils are 4 millimeters in size, and again, they're equal. Now we're going to check the conjunctivi of your eyes. They are nice and pink. Look down, we're going to go ahead and look at the sclera, the pupils, the irises, and the corneas all look good. And now we need to check your cardinal positions, cardinal signs, if you'll follow my pen. Very good. And those are all intact, and accommodation again is intact. So things are looking good there. We're going to go ahead and take the ophthalmoscope now, and we're going to look into the eyes. And what we're doing with this is we're checking the back of the eye for the retina, the optic nerve, the optic disc, the macula, and the other background. And both eyes look good. That was with the ophthalmoscope. And now we're going to go ahead and check the ears. And first of all, we're going to check the outside. The auricles all look good. The external meatus and the tragus is intact. We're just going to look behind the ears, look at the skin. Everything is symmetrical. Skin matches ethnicity. There's no swelling, no lesions. And we're looking at both sides. That's great. And now we're going to do your hearing accommodation. If you can take your finger first on one side and just kind of bounce it. Now I'm going to whisper over here and you tell me if you hear me.
1, 5, Monday.
Very good. And now we'll do the other side. If you'll plug this ear.
2, 6, Tuesday.
Very good. That worked out well. And now we're going to go ahead and do the tuning fork on the top of your head. We're going to go to the midline, and we've got it started, and do you hear that?
Yes, ma'am.
Very good. And then we're going to do the mastoid process with it, and this is testing bone conduction.
Yes, ma'am.
Okay, and one more time. Do you hear that?
Yes, ma'am.
And that's checking air conduction. And we're going to do the same on this side. mastoid
Yes, ma'am.
for bone conduction,
Yes, ma'am.
and air conduction. Okay, hearing looks to be intact. And now we're going to look with the otoscope into the ear. We're going to lift up and back, and we're going to shine straight into the canal. We're looking at the tympanic membrane. Everything looks good. It's smooth, pearl gray, and it's in good position. And we're going to follow with this side over here with the otoscope. We're looking in. Tympanic membrane is intact. It is smooth, pearly gray, and in good position. Okay. Thank you. Okay, so next we're going to go ahead and let me just check with your hands here real quick. We're going to check your skin turgor and accommodation. Your capillary refill is good. Your turgor is good. And color looks good all the way up the arms. And while we're here, we'll go ahead and have you do your range of motion. Flex your wrist down, flex your wrist up, flex your wrist, shoulders, yep, and now straight out. Now bring your arms straight out here, up over your head, and down behind you. Excellent. Now come on down. And we're going to go ahead and check the extraturcular nodes here, and they are intact. Okay, very good. Now we're going to look at the nose. We're going to take our otoscope with a nasal speculum. We're going to look inside. We're looking at the septum and the turbinates and the mucosa, and both sides look good. There's no blockage. Now we're going to check your patency for breathing. Excuse me. In and out once again. Good. It's patent. Both airways are open and working. And next we're going to check for, we're going to go ahead and look at the mouth now. Open your mouth, please. We're looking at the soft tissue. We're looking at the soft palate and hard palate. We're also looking at the tongue, no dental caries. And now we're going to just go ahead and have you open your mouth again. We're looking at the tonsils. They're grade 2, and the uvulus hanging straight midline. And we're going to check the gag reflex, and it's intact. Okay. And if you can, just stick your tongue straight out and down. Good, it's midline, excellent. Now we're going to move on to lymph nodes in your neck. First, we're going to check up here. These are the pre-auricle. Then we're going to move to post-auricle. We're going to move to occipital. Now we're going to go to submental, submandibular. And now we're going to go jugulo-digastric. They're all the right size. There's no swelling, no indications of swelling. Now we're going to do superficial cervical. We're going to do the deep cervical chain. And these are intact as well and no swelling. And now we're doing post-cervical. Okay, thank you, ma'am. And now we're going to test your strength on, first I'm going to do your range of motion. If you can look down for me, and then look straight up to the heavens. And to me again, turn to your left. Good. Turn back to me. Turn to your other side. Excellent. And now shrug your shoulders. Very good. And now we're going to do this against, we're going to test your muscle strength, okay? Press to my hand. Excellent. Hand. Thank you, ma'am. And shrug into my hands. Excellent. Good strength. And now we'll go ahead and check your trachea, and it is midline. Good. And now we're going to check your thyroid gland. If I can have you hold this, we're going to have a sip of water. Let me get my hands in position. This is your thyroid gland. Take a sip. And now swallow for me. Very good. Thyroid is of good size. It's not inflamed or too small. And now we're going to go ahead and range of motion, carotid. We're going to check your carotid pulse. Excellent. 2+ bounding. That's excellent as well. We're do not need to check the measurement for the pressure there because it's nice and strong. Now we're going to go ahead and move on to our interior chest area, okay? First, we're just doing a visual. Everything looks good and symmetrical. We're even in our shoulders and that. We're going to now look into palpating into the subclavicular. Can you shrug for me a little bit there again? Good. Now you can relax. Now we're going to palpate on down. Okay, palpating is good. Now we're going to percuss this area. We're listening for any irregular sounds, feeling for nodules, things of that nature. We've gotten through percussing now, and now we're going to move on to breath sounds. We're going to listen on both sides. I'm going to play my stethoscope. Okay, now we're auscultating for sound. We're listening to your lungs. Inhale and exhale for me. Thank you. Lung sounds are good. I don't hear any adventitious sounds, no wheezes, no stridor. Good. We're going to listen to the lateral lung sounds now. Breathe in and out for me as I do this. Thank you. Okay, that sounds good. And now if you'll just lean forward for me, I'm just going to listen on either side. Very good. Now we do have one other thing. If I can just have you turn around on the stool, we're going to have you facing with your back toward me. Thank you, ma'am. And first off, what we're going to do here is we're just going to visualize, and I'm going to just put my hands here and have you breathe in and out. Big inhale and exhale. Good. That looks good. Now we're going to palpate. We're going to come down into this area. We're just feeling for any lumps or inconsistencies. Things feel symmetrical. Good. Now we're going to percuss. We're percussing down. And now what we would be looking for is the measure the diaphragmatic excursion. What we're going to do is have you exhale for me. And we would do this until we start hearing a dull sound. We would mark that area. And now I'm going to have you inhale. And that's going to put us a little bit lower there. And as we hear that dull sound, we would mark that second one, and that's the diaphragmatic excursion. And we would do that on both sides. And now we're also going to check for CVA tenderness. Breathe in and out. Any pain with that?
No, ma'am.
Okay, thank you. And now we are going to auscultate our lung sounds. Breathe in and out like you're doing. Doing great. We're getting close here. good. Okay. And now we're going to also palpate the spine. We are going to start at the top here. We're feeling the vertebral protrusions. You having any pain or tenderness as I work my way down?
No, ma'am.
Okay. Excellent. I'm going to just work all the way down to the bottom. Okay. Now we're just going to have one last thing. I'm going to have you lie down on the table now. And for this, we're going to be checking your jugular venous. So I need you to turn and face your face that way for me. Very good. And I'm looking at your jugular pattern. I don't see any huge pulsations or bounding extraordinary movements there. This looks good. Now we're going to go ahead and do the pericardium, looking for abnormal pulses or sensations. I don't see any, don't feel anything. Okay, and we're going to percuss. Okay, and now we're going to go ahead and listen. We're listening at the vowel sounds. Now we're going to listen to the apical pulse. And that's mid-clavicular, fifth intercostal space. Okay. Now we're going to auscultate with the bell. Again, we're hearing no adventitious sounds, no irregular heartbeats or murmurs of any type. And now if I'm going to have you do one last thing, turn on your left side. And we're checking here for at the apex of the heart and listening for any irregular heart sounds. And this is at the apical. Okay, everything looks good. You could go ahead and sit up. I'd like to thank you for your time today. I appreciate you letting me take part in your physical. Do you have any questions or concerns today?
No, ma'am. Thank you.
Okay, thank you. And you have a good day, okay?
You too.
Thank you.